Hi, I'm Raissa.
I'm Justin,
I'm Miguel.
And I'm Kevin.
and we did our digital project on returning to physical activity after COVID-19. So, what is COVID-19? Well, I'm sure you guys already know. The World Health Organization states that coronavirus, COVID-19, is an infectious disease caused by a newly discovered coronavirus. It primarily spreads through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. Some symptoms involved are fever, dry cough, tiredness, loss of taste or smell, sore throat, among other things. So the COVID-19 global pandemic, some statistics found on the CDC, a total of 27 million cases in the US, a total of over 500,000 deaths in the US, and a total of 55.2 million vaccines have already been administered. So here we have a video of just a cool little pep talk from a kid. So I hope you enjoy.
Hey guys, listen up! This coronavirus thing has lasted forever. If we're gonna get back out there, we need to work together. We've gotta take care of ourselves. So wear your mask, wash your hands, get your flu shot, social distance. The sooner we all do it, the sooner we can get back to the important stuff, like playing. Unity Point Health. Know how much you matter to this world.
All right, so why is it needed? So COVID is a relatively new disease, so we don't really know what patients are going to experience after they're recovered. So some patients may still experience some symptoms. So this could vary from persistent cough, breathlessness, fatigue, fever, or sore throat, kind of like what Justin mentioned earlier. So there's this thing called long COVID or long haulers. So these are people who experience COVID for a longer period. So even after recovering from the disease, so they experience the same symptoms that they felt when they had the disease. And the theory was it's from a dysfunctional immune inflammatory response. And currently, right now, there are no specific guidelines to return to physical activity for those who recovered or those who are still experiencing symptoms. So this kind of like guideline, this project will serve as a like a guide for those who are recovered. This may also help improve their heart and lung function and endurance. And kind of like what I said earlier, many unknowns remain, so it's important that we start or continue healthy habits. So exercises. So this begins after the individual has been symptomatic for at least 7 days. So at least no fever for about 7 days, no shortness of breath, no body aches and chills. And the exercises have 5 phases, and then each phase is a minimum of 7 days. And then advancing to the next phase requires the criterion to be met. And then we're going to go in detail later. Kevin's going to go on it on each phases in detail. But generally, we want to regress to the previous phase if current phase is too difficult. And there are a couple of things to keep in mind during exercising. Only exercise if you feel recovered from the previous day and no new or return of symptoms. So let's say you started exercising phase 1 today, and then tomorrow you felt like your body aches and fever came back. So stop exercising and just recover. Any abnormal shortness of breath or return of symptoms during exercise, such as increased body temperature, lethargy, or chest pain, you want to seek medical advice. You can call your primary care or just the urgent care, just to say that, hey, I started exercising and I felt shortness of breath, I had trouble breathing, and then they can help you with that. And then you want to have an adequate warm up and cool down and become familiar with the Borg rating of perceived exertion. So right here on the side, you can see the different ratings ranging from 6 to 20.
So for the first phase of the guidelines, our goal is to prepare for return of exercise. And a lot of the exercises here are going to be pretty basic. We're going to be doing some breathing exercises, some stretching to increase your flexibility, and some balance training as well. And we could also throw in a little bit of gentle walking to kind of ease us in and into the program. And we want the RPE to be around like 6 to 8. It's going to be kind of a level of like no exertion and like a very light activity. So for phase 2, the goal is going to be achieving low intensity activity such as walking, light yoga, and light household and gardening tasks. The exercises from phase 1 and phase 2 are actually the same. The thing that's different about phase 2 is that we want to increase activity by 10 to 15 minutes per day. So we're increasing the duration of these exercises every day and trying to keep on progressing in that way. RPE here is going to be a little bit bigger range from 6 to 11. 11 would be pretty much doing an exercise and still be able to hold a conversation without stopping for like air or whatnot. And then in order to progress to the next phase, you would have to stay in phase 2 for 7 days and be able to walk 30 minutes at a level of RPE 11. Phase 3, our goal is to achieve moderate intensity, aerobic, and strength. Exercise here, we're going to be incorporating some type of interval training. So what they suggested was like 2 intervals of 5 minutes of like aerobic exercise with 1 block of recovery in between. So in big picture, you're working out for 10 minutes and resting for 5. And then we're going to be increasing the interval per day as the patient like tolerates it. And activity can include brisk walking, doing some stairs, maybe a stationary bike if you have it available, doing some light jogging, and you could also throw in some moderate intensity resistance training. RPE here is going to be 12 to 14. This is going to kind of be somewhat hard level. And in order to progress to the next phase, you would have to do phase 3 for 7 days and be able to achieve 30 minutes of exercise and still feel recovered after about an hour. Phase 4, we're going to be trying to get moderate intensity aerobic and strength again, similar to phase 3, but here in phase 4, we'll be throwing in some functional skills and coordination training as well. And what the article suggested was having a ratio of 2 training days to 1 day of recovery. So you're doing 2 back-to-back days of working out and throwing a rest day in between that. Some of the activities that they suggested was running with changes in directions, some side shuffles or side steps and shuffles, and also doing some type of circuit training with like body weight exercises. We went ahead and threw in some examples here, like sit to stand, squats, step ups, some lunges, push-ups, and some like heel raises. So nothing like super exerting, but at the same time, we're still trying to get that strength back. RPE here is going to be 12 to 14. Again, same thing as phase 3, somewhat hard level. And then in order to get to the next phase, we're going to be spending 7 days here at phase 4. And fatigue levels should be normal after our exercise. Phase 5 is pretty much where we're supposed to be, like baseline exercise. And for people who are trying to return to their regular exercise program, this is pretty much the next step for that. There's not really like exercises that they recommended because you're going to be going back to your normal like exercise program that you used to be doing before you've got COVID. And then RPE here is recommended at greater than 15, which is at a hard level.
So for patient education, you want to use the 3 A's approach, which are ask, assess, and advise or assist. When discussing education with the patient, you want to ask permission to be able to discuss the topic and make sure that they're comfortable with it. And you also want to ask what their current level of activity is. For assessing, you want to discuss and see if they're willing and motivated to follow the physical therapy program. And that kind of segues into advising your patient to establish goals. And then you can also assist them through motivation, providing modifications to break down barriers. And you can also let them know that even brief periods of their favorite activities, such as gardening or a simple walk in the neighborhood, are very effective. For general education for a physical therapy program post-COVID, you want to make sure that they understand the possible risks of physical activity. People with comorbidities such as myocarditis or pulmonary embolism especially want to monitor their fatigue levels and how their body is responding to the interventions. So with that said, it's important for the patient to self-monitor and track their progression with the exercise interventions. And you also want to let them know that they can return to exercise after 7 days of being free from COVID symptoms, and that they should begin at a minimal exertion level. And if symptoms start to return, or if they're experiencing any new symptoms, then this should indicate to the patient to stop exercise and to seek a doctor.
And that's the end of our presentation. Hope you enjoyed it.